Once when Rahul was unwell, his doctor recommends a blood test. The technician collecting blood samples first checks for a particular kind of blood vessel to prick and collect the blood. Is there more than one type of blood vessel? Yes. There are 3 types of blood vessels in our body: arteries, veins, and capillaries. Arteries are blood vessels with thick walls. They carry oxygenated blood from the heart to all the other parts of the body. Arteries are of 2 types: systemic arteries. They carry oxygenated blood from the heart to the other parts of the body. Pulmonary arteries. They carry deoxygenated blood from the heart to the lungs. Veins are blood vessels with thin walls. They are close to the skin. They carry deoxygenated blood from the different parts of the body to the heart. Most veins have flaps known as venous valves that ensure that blood flows only towards the heart. These valves prevent the blood from flowing back. The pressure of blood in the veins is lower than it is in the arteries. Veins are of 2 types: systemic veins. They carry deoxygenated blood from the different body parts to the heart. Pulmonary veins. They carry oxygenated blood from the lungs to the heart.